Hey guys, I'm Dr. Babes, and today we'll be discussing one of the most common issues of our society during these modern times, your blood sugar. You see, as countries become more technologically advanced and industrialized, everything around us can be automated and be done in an instant. Even with just a smartphone on your hand, you can do almost anything. You need to connect with other people? Go to social media. Are you hungry? Order up a fast food. You can pay your bills, do banking, do your research, or even put up a business, just on the tip of your fingers. However, our society is becoming ever more dependent on these digital technologies. And though this has improved a lot of aspects in our life, these can result to poor habits leading to what we call lifestyle diseases. One of which is diabetes, caused by high blood sugar. Very high blood sugar can cause damage to your organs, especially if uncontrolled for too long. These can have short or long-term effects, not to mention the complications that can be debilitating and may affect your daily life, like blindness or amputation. It may even lead to stroke or heart attack, which can be very fatal. But don't worry, it's not too late. Although there's no absolute cure for diabetes, studies show it's possible for some people to prevent or even reverse it to a point where you may not need medication to manage it anymore. By making a few adjustments and changes, you can make a huge difference and achieve significant results. Today, let's talk about the natural ways that you can do to lower down your blood sugar so that you get to be in control instead of the other way around. First is to lose some weight. It may sound cliche, but obesity and excess weight is the #1 predictor of diabetes. A study showed that for every kilogram lost, diabetes risk is reduced by 16%. And we're not talking about the use of diet pills or liposuction. We want a healthy and safe way of losing it. A good place to start is with your diet. You've probably been told that you can't eat sweets, cut out dessert, or need to follow a special diet. But actually, in fact, the American Diabetes Association no longer recommends specific amounts of carbohydrate, fat, or protein to eat. Instead, they suggest getting these in healthy food choices like vegetables, whole grains, fruits, and legumes, which have low glycemic index. But what is glycemic index? Glycemic index is a rating system for food containing carbohydrates, used to predict how it can affect your blood sugar. The lower the glycemic index, the less it may affect your blood sugar since these foods are high in protein or fiber. In contrast, the higher the glycemic index, the greater the effect on blood sugar level, since these types of foods are typically high in refined carbohydrates and sugar which are digested more quickly, causing a spike in your blood sugar. So you might want to swap out foods with high glycemic index for those with the lower ones. You can have brown rice instead of white, a Greek yogurt instead of ice cream, or try to switch your white bread to whole wheat, or your cereals to rolled oats. We highly recommend that you eat more vegetables, especially the green leafy ones like spinach or kale, for fiber and good digestion, or broccoli or cauliflower, which also has anti-cancer properties. You can also have beans, and don't worry about having gout or high uric acid levels because studies have shown that what contributes to high uric acid are actually due to meat and alcohol consumption. Another interesting vegetable is the bitter melon or chlorella in other countries, which contains properties like insulin to help reduce blood sugar. Studies show that just 2 grams of bitter melon daily significantly reduce blood glucose levels among diabetic patients. Fruits are healthy options as well. However, not all are recommended for diabetic persons. Excellent choices would be apple, oranges, or pears. Now, fruits like grapes, mangoes, and watermelon must be taken in moderation as these have high glycemic index. You can also have berries which have anthocyanins and antioxidants, A 2017 study showed that it can improve insulin sensitivity. Another study showed that eating more magnesium and chromium, which can be found in whole grains, tuna, or even supplements, are beneficial. Extra tip. Do you know that a dash of apple cider vinegar can help in lowering your blood sugar? Research published in the International Journal of Diabetes found that the acid in apple cider vinegar may help control cholesterol, balance blood sugar, and support weight loss, and also reduce hypertension. Try mixing a teaspoon with lemon water as the first drink of the day, or you can add it to a diabetic-friendly salad dressing. However, too much apple cider can interrupt with some of your diabetes medications if you're taking one, so it's best to consult your doctor and limit your consumption to no more than 2 tablespoons per day. Now, while your choice of food matters, portion control plays an important role as well. This is the serving of food you put on your plate. In this way, we can manage and have control of the amount of calories and food we are eating. You may use a smaller plate or also try to plan your meal in advance. Do not skip meals, as this could result in increased feeling of hunger later on, which can lead to eating more. A tip we can give is that instead of eating 3 major meals a day, you can do it in small, frequent feedings throughout the day to prevent a spike of your blood sugar. Also, try to stay away from buffets and eat all-you-can restaurants so that you won't be tempted to overeat. Now remember that these are just general guidelines and that there's no one-size-fits-all diet. This should be individualized according to your needs and your preferences. Next is to stay hydrated. Water is the healthiest drink whether you're a diabetic or not. It has no calories, no carbs, and essential to keeping our bodies functioning. And not to mention, cheap too. Water helps in flushing out excess glucose. The amount of water you need can depend on many factors, but the recommendation is about 2 to 3 liters a day. You may add fresh lemon or mint to make it more palatable with a boost of antioxidants. But just a friendly reminder, make sure that you have no other existing conditions such as heart and kidney problems, as too much water can pose problems in these types of condition. Next is exercise. Exercise plays a big role in diabetes management. It helps in managing your weight along with proper diet. Exercise increases insulin sensitivity and helps your muscles use blood sugar for movement. You can lift weights, do cardio, or even do what we call exercise snacks, or a brief period of high-intensity exercise that typically lasts for no more than 2 minutes. So even if you're busy with school or work, take a break and do some short walks and few squats, planks, stretch, or even just use the stairs instead of the elevator. Or you can do it by just doing your household chores. Just start moving. It doesn't have to be intense, you just have to be consistent. Now, are you already tired just thinking about it? With our modern society, everyone is so busy and too preoccupied with something that we sometimes forget to relax. Your blood sugar might be high because you're stressed. And if you're stressed, your body releases hormones like cortisol and glucagon, which can actually raise your blood sugar. So a way to reduce stress is just to relax. Try meditation, yoga, journaling, or even spend time with your hobbies or being with your loved ones. In relation to relaxing, don't forget to also get quality sleep. We know that sleep is essential, but many take it for granted and are not getting enough. Some sacrifice sleep to be more productive, but this could actually result in reduced focus, making you more feel fatigued, which can add up to stress. You remember what I said about stress, right? Another reason is that when you are sleep deprived, the feeling of hunger is also increased, resulting in eating more than what is required. So how much sleep do you actually need? It differs per person, but a 7 to 9 hours sleep is a good range. If you are having trouble sleeping, it is important to have routines before going to bed so that it can help you sleep. You can have a relaxing bath, block any sound and light, and try to stop using your phone at least 30 minutes before going to bed. Being on your phone stimulates your mind and also emits blue light that mimics daylight, making you feel more alert instead of winding down. Just another reminder that these are not replacement for your diabetic medications. These are just easy, inexpensive alternatives to aid or support in lowering your blood sugar levels. It is important that you regularly monitor your blood sugar. The frequency, it depends on your doctor. If it's on the higher level, you may have to monitor it more frequently. And as your blood sugar consistently becomes more controlled, the less monitoring may be required. Checking your blood sugar can be done easily, and if you need help on how to do it, make sure to check our videos for a step-by-step tutorial so you can do it at the comfort of your own home. Naturally lowering down your blood sugar is possible and can be hugely empowering. It's all about adjusting the lifestyle that caused it in the first place. It may be easier said than done, but at the end of the day, your choices affect your health. Keep trying and be patient with yourself. Progress is progress no matter how small. Eventually, you will be able to see results. Share your favorite tips and routines in the comments below, and if you have any inquiries, you can also ask us through our free consultation. Our link is provided in the description box. Also, don't forget to click the subscribe button and hit that bell button for more healthcare tips and medical advice. This has been your good doctor, and thank you for watching.
To proceed with free online consultation, click the link in the comments section.